Good evening, afternoon, or morning, depending where you are in the world. So wonderful to be here. Thank you for the kind welcome. So we're here today to talk about the Digital Health Planning National Systems course, which quite a number of AHEN members have both contributed to and taken at this point. You just got our introductions, so we're going to skip right past that. Other than to say that both of us have been deeply involved in both the sort of origination of this course as well as sort of the reinvention of it as we've gone. We've learned so much from our students over the years, and we are very much in learning mode and always trying to improve the course and the material and update it. Where did this course come from? Back probably in like 2016, there was a lot of discussion around sort of the problem that we were seeing with many ministries of health around fragmentation in digital health. And we realized this was a complex problem. Like it was a problem with a lot of different actors and a lot of different interests and incentives. And it wasn't something that you could simply buy your way out of or that a single actor could take action on. But we needed a lot of actors, a lot of donors and implementers, governments, technology companies to work together for common purpose. And so we came up with the idea that the best actor to coordinate all of the other actors would be the governments of the countries we were working in. It sounds very simple at this point. It's sort of intuitive. However, we then asked the question, well, how do we do that better? And so through conversations with our ministry counterparts, through experience from projects, we realized that many of the governments we were working with were not in a strong place to coordinate all the different digital health interventions that were being implemented in their country. And that in turn had led to all of these siloed programs, siloed digital health software applications. And that in turn was leading to system level problems around suboptimal health outcomes. So ministry officials would say, well, we have, in some cases, over 100 different digital applications in our countries, but we are unable to exchange the data between them. We don't have a clear picture of what's happening. And this really came to light in the context of pandemics or epidemics, like with the Ebola response or with COVID. We really saw the inability of the health system to utilize its own data quite clearly. And so we realized that as I said, sort of the driver to shifting this was going to sit within strengthening government capacity to articulate a common vision. And we realized it wasn't always just the ministries of health that were going to be leading this, but they needed a set of allies alongside them to form a really strong vision that could align other stakeholders, sometimes even in ways that were counter to the interests of those individual stakeholders. And so that in turn led us to say, well, the most common way to develop capacity is to develop a course. What if WHO, the ITU, USAID, and many other partners came together to develop a course aimed at ministries of health, specifically around being able to articulate and define strong national plans in a way that they were investable. You could actually then invest in those plans. And so in many ways, it's similar to what AHEN itself, I think, has sought to do over its lifespan. And so I think there's a lot of parity in sort of the underlying driver of what we're trying to develop. And it came together in a way that really pulled from a very wide range of stakeholders, people from all over the world, were asked to contribute concepts and ideas into what actually was needed for ministries to really have a strong ability to articulate the vision for their countries. And that in turn led to our course, which we called Digital Health Planning National Systems. It was the first course of its kind. We did a lot of literature review looking around, and we really never found that these sorts of materials assembled in this way. The target audience was first and foremost, and we really did keep this in mind, mid-level ministry officials who serve as national planners in digital health. Um, we didn't, in our thinking, limit it to ministries of health. We realized that ministries of ICT, ministries of finance had a critical role to play. We worked directly with ITU, especially at the beginning of the course, to make sure that those stakeholders, which aren't normally in the health conversations, had a voice in shaping the content and the thinking. And we always try to encourage ministry members from other ministries to take the course alongside their health counterparts. And then the secondary audience of the course are the other national planners and investors, as well as implementers, like large-scale implementers of global digital health systems, so that we had a community that all was using the same terms and concepts, striving for the same objectives at the national level. So I'm going to pass it to Ariel, who's going to walk us through a sort of an overview of what is in the course for those of you who have not had a chance to take it.
Thank you so much, Merrick. And I did pose a question in the chat just to get a sense of how many of you have taken the Digital Health Planning National Systems course in this room. It seems like a good amount of you have, so I won't spend too much time reviewing this, but for those of you who have not, just to give you a sense of then this course that Merrick has been talking about, there was this great need. What did this course actually does it actually include to be able to support national planners? So our course objectives really range from providing new skills and filling gaps to learning new methods and even new approaches, like shifting the mindset for digital health into an enterprise approach, which we will talk about a bit more later, and how that applies to their work. Finally, we also focus on ways to enable our graduates to feel confident and strengthen their leadership skills to be able to navigate some of these conversations in the future. So we'll walk through a little bit more about what the modules themselves cover to achieve these objectives. These modules cover a whole range of the national planning process. We begin with an introduction to digital health, where we lay the foundation for understanding the common vocabulary and terms that exist around digital health. As Merrick alluded to, we pull in from resources from all over the world, especially from the WHO ITU. And something we noticed was a lack of consistency in agreement around key terminology for digital health. So one of the most difficult parts of this course was coming to terms with what was our glossary of terms for this course, what would help our participants understand and speak the same language with each other when they come into the course and when they leave this course. The first module really sets the tone for that. And then we speak more about where does this fit into the larger health system strengthening approach? How does this support patient-centered care, this new kind of thinking around an enterprise planning approach? And finally, we go into the biggest chunk of the course, which is the national digital health planning process. This ranges from everything from beginning with your national digital health strategy to understanding the enterprise architecture itself, to understanding how to cost that out, and then, of course, most importantly, thinking about the governance structures in place, the capacity strengthening required, the policies and regulations in place. We conclude with looking more towards the future, though some of those future pieces are very much with us today, such as AI, and we speak a bit more about that at the end of the course. I might want to note that each module builds on the previous one, so we really try to deliver the course as its full entity as much as possible. The course itself is broken about 50-50 into lecture-based material and activity-based material. This is in large part because our course objectives that we spoke about above are really ambitious, and we don't want people just to understand the material. We want them to be able to have stronger confidence in being able to practice these skills. So we really want to challenge people to not just learn the material in a self-paced way or live with us here, but actually to practice it in an activity. So that is why we have that 50-50 split. And on top of that, we leverage something that we call our fictional case study, which is threaded throughout the entire course. This fictional case study provides the environment to imagine ways in which we can apply the digital health enterprise planning approach from a state of fully fragmented to totally interoperable. And this fictional case study really supports a lot of our activities to practice them in a way where you understand the characters and the context can be relevant no matter where you are in the world. Finally, while it's important to have a context that you can practice maybe no matter where you are in the world, which really supports the scale of this course to be able to be used and leveraged by national planners no matter where they are in the world, we also want to give participants the ability to apply exactly what they're learning to their very, very specific context, which is different. Even within the same country, you might have different challenges. So this final project group presentation gives participants the ability to take the concepts that they've been learning throughout the course and really apply it to a final project that is geared towards taking those concepts and showing us how it will show up in your specific country context. These are some of the most exciting parts of the course, and we love our final project group presentation sessions. Just a bit more about the course itself. I do want to share that we do offer this course in 4 different languages at this point: English, Portuguese, Spanish, and French. And in addition to that, all the materials that we have are open source. They are available with the Creative Commons licensing that you see here. And now it's actually officially considered a content global good for health, which is very exciting. This means that we have a responsibility to really make the course materials as accessible and inclusive as possible for all of you. We need to maintain it and make sure that it's updated and supported well, and share those updates back with all of you. Additionally, we ask that participants share back with us when they've taken the material, adapted it themselves, and share it back with the community, so that we ourselves understand what has been done so far and that the community of participants can take advantage of the work that you all are doing to continue to adapt and make this course what it needs to be for your specific context. And to do that, we've created a knowledge repository of files that we're happy to share with you all if you're interested to see these specific files themselves that ground the course and that you can adapt to your needs. All right, so go ahead, Merrick.
I was going to say, this is really exciting. We're already seeing a bunch of content that has been created by others being contributed. And we're creating sort of a global content archive of case studies that are regionally focused, or different types of activities, and these sorts of things are showing up there. So please do both take the content and shape it to your own needs and make it work for you, but then also share it back so that others can take advantage of that. What have we actually done with this course? We have done 25 course deliveries at this point. Many of those deliveries had 100 students each. 12 of them were synchronous and virtual, meaning that there were live lecturers walking through the lecture material. And 12 of them were what we call the blended modality, where the participants saw the lectures and took them at their own pace. But in both of those, they came together in groups to do the activities. And then we did one in-person synchronous, meaning live in person. Went to Cairo, and the team there delivered it with a whole bunch of folks in the region. Most of the trainings we've done have been in and through WHO, where WHO has reached out to ministries and actually brought the audiences in. But we've also done a whole variety of other types of trainings, such as ones with AHEN. We've done ones inside USAID for the USAID staff. Other donors like the Global Fund, World Bank, and UNICEF have done ones. We've done them in multiple languages many times at this point. And it's just really exciting to see sort of the proliferation and uptake of the course globally, as well as its customization. We've had 720 plus course graduates worldwide. So these are people that went through the entire course, attended the majority of the sessions, and did the final presentation. And so obviously we had a much larger amount of people sign up at the beginning, but these are the people who stuck through. And those numbers just keep going up and up. We've got more cohorts about to wrap up now. And they are from countries all over the world. And one of the things that we actually partnered with AHEN around about a year ago, as well as the other big networks, was we wanted to develop a community of practice for the alumni. We wanted to differentiate it so that it wasn't replicating the same sorts of things that the other communities did, but we wanted it to be additive. We understood that there was sort of a unique resource of people that had invested a fair amount of time into coming up with a common approach to thinking about digital health planning. And we also knew we were updating the content, both updating modules as well as adding new ones. We added digital financial services last year. This year, we're adding one on telemedicine that Jai himself has helped quite a bit with. And then next year, we're going to do one on cybersecurity. And so we wanted the alumni of the course to be able to access those content, be able to share what they've been doing with it. And so we developed this community of practice that has pretty much monthly meetings. Sometimes we go through a module again. Sometimes we have presentations of follow-on of how people have applied the course in their work. If it's something you're interested in, definitely do sign up. We don't sign people automatically. You have to choose to sign up. We've got about 170 of the alumni in that now. And then one of the biggest requests we've gotten is, hey, we want to run this course ourselves from so many participants around the world. And so we did this year the very first training of trainers and had our initial cohort of about 20 graduates who have come out with a group from the Asia region, and I think they're all AHEN members actually. But we had regional representatives from most of the major regions around the world. And it's really exciting to be able to set people up to really understand how we deliver the course in the way that we do, all of the things that happen behind the scene that make it run so smoothly, how to set up the activities, and how to customize the content. So we're anticipating this year there to be a lot more deliveries by a lot wider set of actors. And so our baby has grown up. It's off on its own now, and it's so exciting to see that. What has the course done? Like, all right, anyone can develop a training. Does it actually matter? Does it have any impact? So we started with a grand theory of change. At the very beginning of this presentation, I talked about sort of the impetus that led us to thinking that, investing in capacitating governments and national planners, especially in an aligned way, was going to drive change. And so we turned that into a theory of change, a log frame here, that I'm not going to actually read out to you, but I just want to show you that we did this work, and we're going to summarize it here in a second in a way that's easy to interpret. But we did the hard work of sort of laying out, like, how do we think this is actually going to cause system change in the countries and contexts that we're working in? And then we wanted to see if whether or not our theory of change works. So we did a bunch of monitoring and evaluation a few years ago. We maintained a set of monitoring activities, and we'll probably do some more evaluations again in the future. But from a monitoring perspective, we've done attendance tracking and platform completion metrics. So basically, like tracking the participation and amount of engagement. We can see how long people are in the meetings, whether or not they access recordings, the sort of quiz results, all of that kind of work for pretty much everyone who's taken the course. And then we have the pre and post course surveys. So for every single course, we do sort of knowledge checks before and after, and we were able to look at the differential there. We also do that per module as well, to sort of look at how do people feel about the material they're about to learn, and then how do they feel about what they learned during the time. But that just sort of gives us a sense of do people find the content generally novel, or they understand it? But we really want to understand, do they apply it? So we did an evaluation. We focused on students who were 6 months out from the course. So we wanted people who had enough time to return to their jobs and everything wasn't quite fresh in their mind, but they also had time to actually take action and use the course in their work. And so we worked with 48 of students to try to understand, did they actually utilize the material that they learned in the course? We did much deeper qualitative interviews with 11 of those. We selected out 11 recipients to really understand exactly how did they apply the course materials, not just if they did. And then a few of those we turned into case studies where we found really significant actions that were being taken to kind of illustrate the range of ways that the course material is applied. So here is our simplified a log frame. So we have three, if you were to summarize our outcomes, We are hoping that the students who take the course are going to be more compliant with an enterprise planning approach in their own work, as well as the institutions that they work through, given that most of them are leaders. We also expected people to advocate for the enterprise approach. So I cannot tell you the number of meetings I'm in at USAID where people are proposing digital solutions, and I'm able to sort of step up and just ask little questions such as, oh, is there a national plan? Is this part of are there applications we should be looking at of strengthening? Are we able to link to things like client registries? And it really changes the discourse. So I'm able to advocate for thinking things through about an enterprise planning approach. And then finally, the third outcome is expanding the network, the peer network, so that people can point to examples from other countries, be able to bring in other planners who've done the same thing to influence their advocacy and just understand the best courses of action for them and their specific context. So the first three outputs are all oriented around knowledge, skills, and self-efficacy, and the last one is oriented around peer support. And so we looked at each of these in our research. So if we look at the course outputs and outcomes around knowledge, skills, and self-efficacy, we found that 390 of 420 total respondents say that they're more knowledgeable and confident of applying these course concepts. 410 of 420 stated that the material is relevant to doing their work. 292 of 420 said that all 6 course learning objectives were achieved. And 387 of 420 responded that half or more of the material was new to them. And that was like one of the things we were asking was, we're dealing with mid-career people who are leaders in this space. Are we even presenting material that is something that they need to learn, or do they already know this? And we found that pretty consistently there's elements and aspects, even if they understand some areas really deeply, there are others that are new to them. And I think that was a very exciting outcome. So this sort of summarizes that of kind of looking at within these areas. We had the sort of 92% of the people thinking that the material was new and are confident to utilize it. 97% felt like it was relevant to their job. So we're definitely hitting the audience that we were hoping to hit there. And 70% reported that all the learning objectives were achieved. But we really want to go deeper than that kind of like cursory, is this material relevant to you, and understand what it is that people actually did. So this is where we went into our more qualitative research. And so in these same areas, when we were looking at the questions of did people actually utilize this, all 48 respondents that we engaged with said they applied more than half of the digital health course concepts in their work. And we were not expecting this kind of response. We were probably expecting, 20% of the people to say they were applying more than half in their work. And so this was like really a positive surprise that the material we were teaching was having broad applicability across every single respondent we engaged with. And those were picked to be representative of the overall course participants. And then when it came to the peer support side, again, 100% of the participants indicated that they use their digital health knowledge to support other colleagues who didn't take the course, so that there was a lot of teaching what was in the course to other members of their cohorts. And then we wanted to really understand about whether or not the material was being applied in people's work. And so we used a common framework from the educational space called Bloom's taxonomy. And this sort of looks at how much students do with what they learn. And so at the bottom of this, which is really our goal, we were seeking for students to both be able to remember and understand these concepts. That's all you could really do with a virtual course. That's all you could really sort of guarantee that, like, okay, we're going to guarantee that people who graduate from the course are able to remember and understand. And sure enough, we found 100% of the participants 6 months after the course were able to remember and understand. um, uh, uh, that they really grasped the course material, or may not. And then the real next question, our aspiration was, were people able to apply the material in their work? And this we were not certain of. Like, we were really anticipating, given the quality of engagement of the course, people would be remembering and understanding, and that was sort of our goal. But our hope was that people would be applying the work. And so we found that of the people that we engaged after 6 months, 100% were able to articulate ways that they applied the material in their jobs. And so this was really, to us, like quite exciting, because that was their theory of change. So we were actually going to change systems by empowering people with the knowledge. But interestingly, had we stopped there with our findings, that would have been great. We would have been completely happy. But we additionally also found examples of people analyzing, evaluating, and creating new work, really applying it at a much deeper level. And so when we found some instances of that, we grabbed those participants and did much more thorough case studies with them, or interviews with them, which we then turned into case studies to try to understand what is happening when people are actually taking this work and building new things from it, or really changing the way that their countries work. And there were a lot of stories like this. Across the sort of research, we found that people applied the work in sort of 3 roles. Sometimes people utilized multiple roles at different times in their work. Sometimes they really fell into one of these strongly. So the first category was people who graduated the course became capacity builders or trainers themselves, where they really focused on sort of spreading the knowledge throughout their immediate work network. Utilizing the slides, sometimes even teaching modules like stories of that, but often just sort of really focusing on how do I get more members of my institution or organization or immediate network to understand these concepts. The second was as a technical consultant, so advising their team on best practices. And so this is something which I think that's kind of what we're imagining people to be doing, is they're able to utilize course material to advocate for decisions or do direct planning. So examples of people writing their national strategies or developing their blueprints or architectures. And finally, advocating or influencing key stakeholders. So again, this was one of our core objectives of the course, is to basically prepare people to be able to advocate. And I will tell you, from USAID's perspective, we're hearing from our country offices around the world that the governments they're talking to are running circles around the USAID staff. And the USAID staff is like, I don't know what's going on in the digital space, but the government is coming very prepared and has a clear vision of what they're trying to do. And we need to catch up to them now, which previously had not always been the case. And so I think that's really exciting. One of the case studies is Dilip, who was a WHO regional officer and took the course, 17 years of experience, worked for WHO and was supporting the government of Laos. He'd been there for 3 years and worked with a variety of stakeholders to support donor coordination and the Ministry of Health's role as a steward for HIS strengthening. And at the time that he took the course, Laos was receiving significant funding for building a lot of digital health applications, often related to COVID-19, but there was a huge amount of fragmentation in the space. And so he realized it was a critical moment to put a digital strategy in place to try to shape all of the incoming investments in. And so he took the course to support his colleagues, the Ministry of Health, to develop that digital health strategy. And he applied all of the concepts from the course directly into the development of that strategy, thinking through the building blocks enabling environment, using the WHO ITU eHealth strategy toolkit to develop that. He used the course resources to develop governance structures for the country, and used the maturity models to understand what sorts of approaches would be taken. He explicitly prioritized interoperability within that strategy, emphasized the role of standards and shared registries, and included both members of the ministry and the private sector throughout the entire process to ensure buy-in. So he actually did what we advocate for in the course almost directly. And it's just really exciting to see that all come together. He really was able to articulate his role as strategically supporting the development and finalization of Laos' 5-year digital health national strategy, using that enterprise planning approach. And so this is the exact kind of example that we had when we were doing this sort of case studies of what does it mean to use the work, or like what did you actually do with it? And so this was a really strong example of how the course was directly applicable and then utilized to develop an entire nation state's digital health plan. Another exciting example is one that we had nothing to do with directly, which is cool. It goes back to that idea of this course being open, Creative Commons, and available for people to use. In this case, it's an example from Mongolia. Dr. and I'm going to pronounce the name wrong, but Baya Batar Bold, who founded the Mongolian Society of Artificial Intelligence in Medicine, took the course on his own. In one of we offer it just as like you can just go through the material yourself by yourself, which of course isn't all of the material because you don't have the learning activities, but it's the course lecture material. Went through it and found it to be incredibly useful. And then funded the translation of the course itself into Mongolian for his country, advocated for other professionals to take the course, and worked towards making it one of the options for getting continuous learning points as a medical professional in Mongolia to maintain medical licensing. And so this was an example of someone finding the material and actually becoming that trainer, peer support modality. It's actually up on the Mongolian website. Or Mongolian government's website. You can go and like walk through all of the material in Mongolian if you speak and read Mongolian. And so that's just another really great, deep example of how people really built on top of the idea of the course and applied it in their local country context. If you're interested in additional case studies, we're happy to share those out. I'm sure Ariel can share those. We have at least another one from the Asia region, and I think the other two are focused on other regions. But one of the things we wanted to like jump into was the fact that AHEN had managed and ran a number of deliveries in 2022, and they were some of the best attended and best groups. That's not the data actually supports that. That's not me just saying that AHEN is great because I really because we're presenting to you, but like the data actually showed that AHEN really did a strong job relative to other cohorts. And so we did the 9 self-study modules, once a week live deliveries. This was supported by AHEN, by Patrick J. McGovern Foundation, USAID through the Digital Square mechanism and path. We had 97 participants from 13 countries, and 72 participants completed the course with a certificate. The participants were divided into 13 groups for final projects, and 12 groups managed to complete all the tasks and made it to the final presentation. So the 13 countries represented, you can see here, we had quite a number of participants from a few of them, like Nepal and the Philippines, Thailand, Sri Lanka. Also, for those of you in Thailand, you got the shout out in The Economist a couple weeks ago. I read that article on talking about how strong the Thai health system is and how it's really a model for other countries to look at. So just congratulations for that kind of global acknowledgement. But so many participants from Sri Lanka, Malaysia, and then sort of a smattering from other countries, all sort of able to work together. There were 58% of the participants were men, or 40% were women. So we're getting closer to parity here for gender. Overall, from the participants, the majority said that the quality of the course was very high, and then the rest said it was like one notch below high, so good. So high and very high was 100% of the participants who reported on this. And then did the course achieve its learning objectives? 50 of the members said that it achieved its learning objectives, and 15 said that most of the objectives were covered. Here's the data for how people intend to apply the learnings. So again, this is kind of like a range of types of actions, but being a resource to the team in digital health, advocating, implementing activities directly from the course, training other colleagues, and training key stakeholders outside of their work directly. So I mean, oftentimes or advocating to companies or private sector actors, or if you're government donors, if you're a donor government, to try to get people around the same table to have the same ideas. One of the testimonials we got from Kristen from the Philippines was that the DHPNS course has grounded them on the foundations of digital health and helped a lot in systematizing the insight and learnings that they've gotten from coordinating various activities and projects in AHEN. And I think this is really sort of like one of the main goals that I was hoping for was, and as someone who helped develop the content, I found it really did this. It helped me organize my thinking. I was exposed to so many reports and so many approaches and ideas, and being able to have them laid out and organized and understanding the relationship to them was really critical. And then also, she really appreciated the ability to learn with the whole community, which I think is another wonderful aspect of the course, is developing those community aspects. Another testimonial from India, from Manisha, was that it was a very comprehensive course. And she really enjoyed the sort of use cases, examples, exercises, games, and projects. And for those of you taking the course, there's sort of a capstone activity of a board game that replicates the role of planning a national system that's always been quite a big hit. And then from Bhutan, Peldon said, it's a very interesting course with case studies, group activities, and sort of enabling people to think through the challenges that they faced in the digital health space. And finally, from Alvin, who I think all of us know very well here in the AHEN community, he stated that the DHPNS course takes a strategic approach to digital health enterprise planning, and all national digital health authorities should take the course, as it's a good introduction to the field. And I find it's also, like, even as someone who's in the field for a long time, a good way to again, organize that knowledge and have a common approach, common language. So with that, we'll just thank all of those who participated and contributed over the years. This list is, I think, what we legally put up in our slides, but really this was a global effort, and there were participants from almost every major organization who's worked in the digital health space, contributed to it, and helped shape this content and this work. So many case studies and peer review that was done. I just can't thank the various participants of this community itself for making this course what it was. And I think with there, you were going to have us shift to questions and answers. Is that right?
Yes, thank you, Merrick and Ariel, for walking us through the HPNS course again. And before we proceed with the open forum, I'd like to invite our AHIN Secretariat from Malaysia, Jocelyn.
Hi, everyone. So I'd just like to share one slide, a very quick one, because we did a survey after the course as well. So we asked them who wants to join the TOT program of DHBNS in the country. So we actually have a very huge amount of people who has interest to join the TOT. So we're also very grateful that we have 5 of them join this cohort. So I'll pass on to Sergey to introduce the reactors for tonight.
Thank you, Jocelyn. Thank you, Merrick and Ariel, for being with us today and then sharing. And then, yeah, Merrick mentioned about the AHIN delivery that happened in 2022. But one of the things that I also wanted to highlight is his support, without which we may not have been able to deliver the AHIN delivery that year. And then one of the things that we believe is, like, we encourage as the course objectives, it was mentioned, like, it was important also for our working council members, especially, and then also our secretariat team, along with the other members, that we were able to actually be part of that delivery. And as it said, like, the proof of the pudding is in eating. Like, so today we would like to have the train of those who took the TOT program recently. Like, I think we have 4 of us joining in today's webinar. Like, I would like to mention briefly about them, and then request them to quickly introduce. Like, please do not take more than 1 minute, but then, like, quickly also share the experience and feedback from you, because I think it's good to hear from you. You took this course and then also have taken the Train the Trainers program. So it will be very helpful for us to know what has been your experience, and then how you have already put the course into practice, or how you intend to do it. That's something that we would like to actually ask you to share. Like, I would like to call upon Dr. Prasad Ranatunga. from Sri Lanka, and then followed by Dr. Aminul Islam from Bangladesh, and then Dr. Zoljargal from Mongolia, and then Jan Michel Herbert from Philippines. Thank you. Over to you, Dr. Prasad Ranatunga.
Hi. Hello, everybody. Thank you, Jack. Yes, I'm really grateful that he got us this chance to follow this course, because actually I'm a specialist medical doctor in health informatics from Sri Lanka. I've been working on digital health maybe say past 20 years, but it was not called digital health back then. But then I have formal education qualifications as well. But to get the real picture of what it is, there are so much resources out there. But all of that I could place them in an organized manner because of this course. And on top of that, the TOT, the training of trainers, was really nice. It helped me a lot, to be confident in teaching others. I've been doing that since I completed the initial course. But then we be able to work as a facilitator with TechChange. That was really great. I'm really grateful for the AIN as well as TechChange and all other agencies involved. Thank you. Aminul?
Thank you. Thank you. Hello, everyone. Greetings from Bangladesh. First of all, I would like to extend my heartfelt gratitude to AHIN, the entire team, that they created such opportunity for me to take this course. Previously, I have completed the DSPNS course, and then this is a great opportunity for me to take part in the TOT course. It is a different level, basically. TechChange and USAID, the whole team, basically, I think they put a lot of effort to design such a course. So I had to participate as a lead facilitator and then a support facilitator. So all type of roles, they basically practically showed us how to do that, and how to, and as a academicians, basically. So I would request Merrick to include also academicians role in your target area, because as academicians, I got a lot of insights, and it helped me to deliver the lecture in the classroom from your content and the way you put the things. And also, I also work as a technical consultant for Ministry of Health Bangladesh, MIS, and all the role that I played is tremendous, basically supporting me incredibly. Is useful, this course, and the way you basically interacting during the course, like all the participants, all the trainers, all the facilitators, they're really cooperative and very helpful. So we learned a lot from this course, and now we are ready to deliver, as a lead facilitator. So if it is like you have the opportunity to to utilize us, we'd be very happy. Thanks, everyone. This is all about for me.
Hi everyone, my name is Zoljargal, or Zoe. I'm from Mongolia, and I had the chance to participate in the course and then as well as the TOT program. And the content of the course in terms of digital health, it was really useful. And just recently, our country just conducted the first ever digital health landscape assessment, and we just literally followed the course content and assessed our country's digital health landscape according to the building blocks of the National E-Health Strategy Toolkit. And I'm very grateful that I was able to apply the knowledge that I studied. And I also wanted to bring out one more thing. When I was studying the TOT course, the content is very useful. On top of that, how the course was executed, there was so much to learn, how the course content was organized, how it was presented, and also how the facilitators were facilitating the course, like how they were providing that very welcoming environment, etc. Like there was so much to learn, not only the digital health aspect, more about like have to be a better like facilitators in the course, and like there was so much to learn professionally. So for that, I'm very grateful. Thank you.
Good day to everyone. So my name is John Michael Herber. So I'm one of the graduates of the AHIN cohort and also the training of trainers course. So I'm currently together with Dr. Alvin on under the University of the Philippines Standards and Interoperability Laboratory, and we've been advocating for the use of digital health and also use of standards and interoperability. So going to my perspective as a student, as a participant, it really helped us, kept us grounded on the concepts of digital health. So just like Christine mentioned earlier, it really kept us grounded and made us know the foundations of digital health. And if you go to if you learn or you attended the course, you will be and exposed to the enabling environment. So very important aspects that it's the course is anchored on. And what I also like is the case study. So it really keeps you these theoretical concepts keeps it related into your day-to-day life. What else I've placed here? Also, what I liked about as a student, you get to learn with different countries, so you know different perspectives and approaches that they've done. So that's what I really liked about the course. Moving towards the training of trainers. So from a student, we try to transition to be the ones who will teach the content. So it's a great experience as well. So as Doc Zoe mentioned earlier, it's a different experience. You try to get to be on the other side of the scene already. And then recently, as Ariel mentioned earlier, so me and Prasad has been contacted to be part of to be support for a cohort delivery. So it's another experience because it's already run we're already testing the training of trainers the concepts that we've learned at the training of trainer courses. So it's a different experience as well. So overall, it's a very humbling experience, and I can't wait to share what I've learned to others. Thank you.
Thank you, Sir Burr, Dr. Prasad, Dr. Aminul, and Dr. Zoe for your insights. Before we turn over to Dr. Bunchay, I think there's a question in the chat from Dr. Muhammad. So how do you get into the training of trainers program or course?
So we did the pilot of that this year, and we'll probably do another one next year. When we do, we'll be reaching out to the organizations like AHEN, Helena, Rekensa, through WHO as well, to identify people that can be part of the next cohort of training of trainers. So I would say if you would want to be a trainer, first you have to complete the course itself, but then reach out to AHEN and the leadership there can coordinate and let you know when that happens.
And we can also collect your names if you're interested. I'm happy to share an interest form here in the chat, which I'll about to send. But yeah, as Merrick said, we do ask that you've at least graduated from the course. That will really set you up for success.
Thank you, Ariel and Merrick. Maybe you can also mention briefly about the course that can be taken offline, right? Like at their own pace. Maybe someone like can get used to that if and when there are live deliveries or blended deliveries being offered by the networks or partners, then they can actually jump onto that. But till then, like probably they can do like a kind of a bridge.
Yeah, absolutely. I just shared in the chat the link to all the self-paced course materials that Jai was just mentioning. Thank you so much for setting us up for that. And I also can share in the chat a sign-up sheet for registering to actually be in a cohort-based experience, which is the one that produces the certificate at the end. But this has all the same material, just without the live activities. So because of that missing piece, there's not a certificate piece attached to it, but it still would get you pretty far and be useful for any of you. And it is available right now in 4 different languages, which that link will take you to. And free and open. So just go for it. You just need to create a login if you don't have one.
Yes, thank you, Ariel and Sir Jai. I think we've reached the top of the hour, but I think there's something that Dr. Bunchay would like to share. Dr. Bunchay?
Yeah, can you hear me?
Yes,
Yes,
Dr.
Dr.
First
Bunchay.
of all, thank you, Merrick, for from the USAID and Ariel from TechChange that create this kind of the fabulous courses. And congratulations for Merrick to be promoted. And we are happy that we have this opportunity to congratulate you. I have one testimony. What my testimony is, I myself teaching informatics in the university, and I also the course that I teach is the standard and interoperability, HIE standard and interoperabilities. And several material from the course has been helped me a lot on simplify teaching the master degree, PhD degree, and medical student. That one thing. And another is that material related to the video about the concept of the interoperability that create that help a lot. We can assign them to watch before and after the class. So that is what we are very happy and thank you for these global goods. So the second testimony is that the board game. I fortunate to get the gift of the actual board game from Merrick, and I had been used with my class, and it seemed like with the physical board game, it kind of the enhance the an understanding of what we discuss in the class. So that is two things that I don't know that it can be say that the testimony, but it helped me a lot. Even I am the one that teaching in this topic. Now come to the recommendations. First, I would like the USAID and TechChange can create more kind of the expanding, not just this kind of the generic one on the national planning health system, the concept, but maybe coming with the shortened small module that can be follow up on that in several components of the WHO ITU e-health enable component. The second thing is that now Ariel said it is free, so Mongolia can be a good example. I would think that if we can have like the board game, the template or something like that we can translate it and then create in our local with that board game. So we can create the local language, physical board game that can be used. I don't quite sure that the board game is licensing or not, but the board game with physically attended it much fun and much understandable than the online board game. And thank you again. And I hope that we're going to have another global goods that we can contribute to this. Thank you.
Yes.
Thank you, Dr. Bunchai. I think we are we have a few minutes above the time. Maybe other questions, if there may be, like we could collect and pass on to Merrick and Ariel and get the response. So I hope that's okay, because I think we are 5 minutes past the time. Maybe others probably have to leave. And then maybe we can also have a quick group photograph, if that's okay.
Thank you, everyone.
Thank you, Merrick and Ariel, for joining us and having a very interesting webinar. Thank you, Dr. Prasad, Dr. Zoe, Aminul, and Herbert. Thank you.
Thank
you,
you.
everybody.
So much.
It was really
Thank
an
you.
honor to be here. I really appreciate hearing from all of you. Thank you.
Thank you.
Thank you.
Thank you. Thank you.
Thanks.
Thank you.